So, ladies and gentlemen, welcome to the webinar entitled Liver Transplantation for Hepatocellular Carcinoma Up to Date. My name is Pierluigi Toniutto. I'm the chair of the Hepatology and Liver Transplant Unit at the University of Udine in Italy. And first, I would like to thank Professor Ramadori and the editorial team of the Hepatoma Research for giving me the privilege and the honor to be the chair to this webinar. Also, I would like to thank a lot Ms. Victoria and her collaborators for their really appreciated support in the organization of the webinar. I would like also to thank all the speakers that accepted the invitation to participate at the webinar. And I think that they allowed to a formation of a fantastic international team of experts in the management of hepatocellular carcinoma. I will advise you that there will be a small variation in the original program since the speech of Professor Cillo will precede that of Professor Zucman-Rossi, and I would like to thank Professor Zucman-Rossi for agreeing to this small variation in times. And just a few slides, if I okay, I will share my screen. So just a few slides to introduce the webinar. I think that the webinar should be divided in two main sections. The first one may be entitled The Changing Characteristics of Patients with ACC, because as you know, ACC related to alcohol and NASH will probably surpass those related to viral hepatitis. This implies probably that ACC diagnosis in the more recent times will be out of programs of surveillance. And this implies probably that many patients will present ACC with increased size on number of nodules. And these patients probably will have multiple comorbidities, such as metabolic comorbidities, nutritional, and also social, particularly for those with alcohol consumption. So the surgical approach to these new patients with ACC probably will be modified in terms of technical issues, in terms of the potential role of neoadjuvant or adjuvant local or systemic treatments. These very important issues will be discussed in the first part of the webinar by Professor Patrizia Burra from Padua in Italy, by Professor Schwartz from Mount Sinai in New York, and by Professor Citterio from National Institute of Oncology in Milan, Italy. At the end of this section, we'll be able to open a discussion, and all the attendees will be sent by a Q&A tab your questions and answer. Please identify before to send the question, the name and the country, and the speaker who the question will be addressed. So the second part of the webinar probably may be entitled New Options to Select Patients with ACC for Liver Transplantation, because the addition of the new utilization of genetic and histological markers, in addition to the morphological criteria, will be needed to better select patients for liver transplant. As you know, currently we adopt genetic and or histological markers to evaluate response to treatments and to quantify the risk of ACC recurrence, besides the select patients for liver transplant. A very important issue will be to move from the static to dynamic view in the selection of patients for transplant. And a very important issue is to discuss more in detail to the concept of downstaging treatments that currently probably are the best surrogates that we have to identify the aggressiveness of the tumor. This implies a very difficult discussion to select what is right, for example, extended criteria, to what is possible, for example, advanced criteria. And we will have many patients that underwent liver transplantation beyond the Milan criteria, and many of them probably will have an increased risk of ACC recurrence after transplant. So the very important issue will be how to monitor the risk of ACC recurrence in these patients. And it will be very important to define if we need to personalize or we maintain a generalized follow-up modalities in these patients. So the second part of the webinar, the very important issues will be discussed by Professor Umberto Cillo from Padua in Italy, by Professor Jessica Zuckman-Rossi from Paris in France, by Professor Jan Leroux from Bruxelles in Belgium, and by Professor Akamatsu from Tokyo in Japan. So I think that we should start the webinar, and it's my pleasure to introduce for the first lecture entitled The Changing Epidemiology and the Risk Factors for Hepatocellular Carcinoma, Professor Patrizia Bura from Padua in Italy. Please, Professor Bura.